Assalamualaikum warahmatullahi wabarakatuh, dear students. Please, I would like to apologize for not having a physical class with you guys for these topics. But don't worry so much because I think about 2 to 3 MCQ will come out from this topic, and also one short MEQ about 4 marks from this topic. Yeah. So today's topic is on the psychosocial development theories and its application, focusing on the moral theories by Kohlberg and Gilligan. And the second part that I will record a lecture on is on the spiritual theory, faith development from Fowler, another theories, and also from Islamic perspective by Said Nursi. So we start with Lawrence Kohlberg for the moral development. So Kohlberg is a well-known psychologist from America that he did a study on the moral development where he studied the children. The participant is on the children. So he tried to understand the moral development from the children perspective up until adolescent. And his finding and research have become important contributions to the field of psychology, where the current researchers keep on using and keep on confirming the Kohlberg's theory for the educational model. Yeah, so this is a famous theory. So from Kohlberg's theory, uh, he said that moral develop by stages. So how children learn and develop the sense of morality is from stage 1, stage 2, and so on. And there are series of stages, and everyone will go through the each stages from 1, 2, and 3, and 4 accordingly without skipping any stage. Yeah? So this is similar to stages theory by Piaget about cognitive development. So Kohlberg also developed the stages theory based on the study or the theory of others. So moral development is a growth, and in this example, one cannot walk before you crawl. That means the previous stage in the moral development teach something about how the moral grow from stage 1 until stage 2 and stage 3 and so on. Okay? So according to Kohlberg, there are 6 stages in the moral development, and he believed that only 25% of individuals ever grow to level 6. So the majority or the adult stops at level 4, which we will go through after this. Yeah? So there are 3 levels. So in this level, in each level there are 2 stages. So the total stage of moral development are 6, and they are divided into 3 levels. So level 1 belongs to the children, which more to self-centered or based on their self-interest. So level 2 focus on the adolescents until adult. The conventional group, which is more to group centered, they prefer to make a self-sacrifice as compared to level 1. And level 3, which is more to a personal level, it is called as post-conventional level or internalized truth-centered, which is more personal as compared to the group-centered. So for the level 1, which is more to self-interest or self-centered, belongs to the children. So from a 7-year-old, the child develop fear of punishment where they try to avoid and obey. So this is based on their self-interest because maybe their personal fear make them make the moral choices. And stage 2 is based on the obtained reward or exchange of favors. So here you can also relate with the operant conditioning theory for the learning theory, where reinforcement and positive rewards uh, can help in developing the moral for this stage 12 for the children especially. And for the level 2 belongs to the starts with adolescence. So this one you need to remember for the stage 3. This is very important. It may come out in the exam. So for this group, the moral developed based on what the group prefer. That's why it is called as good boy, good girl. So they may rely on the others, or they may rely on the decision of the others in order to be accepted. Yeah, that's why it is called as good boy, good girl. In stage 4 is the law and order, where the group rely on the social expectations of obeying the law. Yeah, this is for the moral. And level 3 for the social contract is where the personal or individuals make informed choices based on distinctive or their critical assessment on what needs to be done, what needs to be followed, and so on. And the last one is the universal or ethical principle or integrity. This one belongs to the certain individuals with a higher personal preference or personal integrity about certain moral. They may involve those policies makers or the law, those involved in law, or revision needs to do the revision of certain acts and policy. So we go to one by one in a simplest way to understand this. Level 1 belongs to the children. They prefer their own desire as the basis of their moral judgment. Level 2 belongs to the adolescent, where they follow the group or the social standard when make the moral judgment. And level 3 belongs to those adults with more personal preference based on their own ethics, where they consider the right and needs of others when they make the judgment as a whole. Okay? So this is for stage 1. So I will provide example after this. So stage 1 and stage 2 belongs to the children, or they focus on their self-centered or self-interest. So we go to level 2 now. So level 2 belongs to conventional morality, which belongs to the adolescents and adults. So this is more to the group centered. And like stage 3, this is very important for you to remember. Remember, yeah, this may come out in the exam, where good boy, good girl, they make decisions based on the basis of what will please the others, what will please the mother, the father, the healthcare professional, and so on, especially the friends. And they concern about maintaining interpersonal relations for their moral decision. And for the stage 4, this is for the law and order. It look to society as a whole for the guidelines about behavior. So for these adolescents or adults, they will try to portray that they are a good citizen, for example, and they will try to follow the law as much as they can. So this is for the stage 4 for the conventional. And level 3 belongs to the post-conventional morality for the adults, where it consists of stage 5 and stage 6. Stage 5 is for the social contract, where they recognize that there are rules which belongs to the social agreement, and it can change according to the situation, so whenever it's needed. and it also concerned about the maintaining interpersonal relations. But bear in mind that this social contract is very personal to the individuals, and we cannot say that every adult can get into this stage 5. So, for the stage 6, this is a universal ethical principle where the individual adhere to a small number of abstract principles that transcend specific concrete rules, and they try to answer the inner conscience or the truth within themselves where they think this is right. So only philosopher or a deep thinker or policy maker can reach universal ethical principles because they need to think about the others uh, as well. Yeah. So now I would like to provide example here for the case on the moral dilemma, but you need to look it from the perspective of children and adolescent. Yeah? So for stage 1, obedience, a moral dilemma is about a man named Heinz. Sorry, here I forgot to change the name. About a man named Heinz whose wife is dying because there is one very expensive treatment option for her that Hans cannot afford. So from the child perspective, trying to obey stage 1, their perspective would say that Hans should not steal the medicine because he will consequently be put in the prison. Okay. But for the stage 2, based on the self-interest, so still belongs to the children who starts to develop some cognitive improvement as compared to stage 1, and you need to remember that those in stage 2 they already go through the stage 1 for the obedience. So here they try to focus on the more of their own interest, where from their perspective I should stay the medicine because he will be much happier if he save his wife. So this is based on their self-interest, although they from these children's perspective they also understand the consequences, where the children will say that he will have to serve a prison sentence. So move to stage 3 for the conformity or good boy good girl. Okay, this is, you have to remember about this good boy good girl because this will come up in the exam where I provide the example, and you have to choose which stage of the moral that this scenario try to portray. So for the stage 3, from the adolescent perspective, he wants to be a good husband. Yeah, this is for the group preference. So, or I should not steal the drug because stealing is bad and he is not a criminal in order to be part of the society. Or he has tried to do everything he can without breaking the law. You cannot blame him. Okay. Okay, moving on to the stage 4, where for the law and order. So from the adolescents or maybe to adults perspective, because most of the adults stop at stage 4 for the law and order. So from the adult perspective at least, I should not steal the medicine because the law prohibits stealing, making it illegal. Or maybe Han should steal the drugs for his wife but also take the prescribed punishment for the crime, as well as paying the druggist for what he is owed. So criminal cannot just run around without regard for the law. So this is from the public perspective on moral regarding the Heinz case, yeah. Uh, which is for the adults. And for the stage 5, where it is called as the social contract orientation, so for the certain individuals, we cannot say all because now this is the stage where the personal preference or personal thought play the biggest role. So from this perspective, I should stay the medicine because Everyone has a right to choose life regardless of the law. Or Han should not steal the medicine because the scientist has the right for the compensation. So in this stage, the individual starts to be critical regarding what will be the consequences, not what the society wants. Okay. And for the stage 6, where only certain deep thinker will go to stage 6, so from their perspective would be, Han should stay the medicine because saving a life is a more fundamental value than the property rights of another person. Like, this is beyond the stage 5, where the individual recognize that the scientists who produce the drugs have their rights. But for stage 6, their thinking is on saving a human life, which is more fundamental, or I should not steal the medicine because others may need the medicine just as badly and their lives are equally significant. So this is for the stage 6. However, there are criticism that Colbert's received regarding his theory, where, according to the others, Colbert's theory only reflects on the man. So, from this perspective, from this theory, only men go to the stage 4, okay, as compared to women. So here people are not agree that Colbert often neglect the moral reasoning patterns of a woman, where they think that woman is more towards the caring and understanding as compared to men, which is more objective on the law. So the other criticism that this theory is conservative is that this theory often see as only reflect the upper middle class value system which belongs to the America as compared to other countries with different socio-economic backgrounds like the poor, the lower middle class people. So it does not really reflect the moral reasoning of the other people. And there are discrepancy between the moral reasoning and the behavior because although this theory try to uh, uh, portray about the moral reasoning or the moral judgment or the certain dilemma, but it all depends on the thoughts, or it does not reflect the actions. So from this perspective, yes, we can understand the moral, but not the pattern of behavior of the certain society. Yeah. And it also overemphasizes on the justice, where they try to uh, uh, find the gap where there's a lack of compassion, emotional values, as well as a caring perspective in this Colbert theory. And it is also age bias because this study was conducted for the children below the age of 16. Okay, like I said, the study was done among the children and adolescents. So for the adults' perspective and stage 5, stage 6, more study needs to be done in order to understand the complexity of the moral reasoning. Yeah? And still, Colbert's theory is applicable up until now, where the teachers can use it as a guidelines to foster a relationship in the classroom, especially for the good boy, good girl, obedience, stage 1, stage 2, stage 3, and build a sense of community and encourage open communications. Yeah? And Colbert's theory of moral development can be applied to the nursing for understanding about patients, moral reasoning, about whether they try to obey to the treatment or not, and ethical decision making about the beneficent autonomy and so on. And this moral development can also be used for the patient education in order to become the advocate to make people value their own decisions, their rights, okay, the consequences and so on, and also for the professional development of the nurses themselves for continuing or upgrading their own knowledge in the caring. And in nursing stage 1, we can try to understand the moral reasoning about the patient's self-interest and what they want in order to avoid the negative consequences of being a patient or being hospitalized. For example, here a patient lies to the healthcare professionals about their symptoms in order to avoid getting trouble, in order to avoid being hospitalized, in order to avoid the dosage of drugs increased by the doctors. So these are the examples of obedience for the moral, or the other example is that a nurse disclose an error made in the patient care because they fear of punishment or getting into trouble if they don't. For example, the nurse are very busy and they supposed to take the vital signs. Let's say they forget or they may skip certain steps in the taking the vital signs, for example. But still, if they document about the normal vital signs, for example, the respiratory rate, they just record as 20 for the whole patients in the ward in order to avoid being punished. Still, this is a very wrong, yeah. But this is considered as the stage 1. And the stage 2 is belongs to the self-interest. At this stage, individuals is focused on the self-interest, but they also recognize the interests of others, especially the needs of others. So, example, in a patient case, a patient declined a treatment option because they believe the potential risks outweigh the potential benefits, or the nurse collaborate with colleagues in order to provide safe and efficient care. So these are the examples only. It may not come up in the exam. Yeah. So okay. Now moving on into stage 3 for the conforming and interpersonal relationship. This one you need to remember that stage 3 is belongs to the level 2 for the conventional level. So they prefer for the group. They are more to group centered. So stage 3, in short, we call it as good boy, good girl, good boy, good girl stage. So this is easier for you to understand. So what is stage 3? So at this stage, individuals are concerned with gaining the approval of others, and moral reasoning is driven by the desire to be seen as a good person. So this one is similar to obedience, but here the focus is more to have or to preserve a good relationship. So, for example, a patient seek medical treatment because they are concerned about the impact it could have on their relationship with the family if they left untreated. So they still consider about the other's need as compared to their own needs. So the difference between this stage and obedience stage is that obedience is more focused on the self-interest as compared to the stage 3. And another example is that a nurse seeking input from colleagues on patient care to ensure that everyone is on the same page and that the patient receives the best possible treatment. So same here that they rely on the group the group mechanism or the group efforts in order to get the best result for the patients. For the stage 4 is on the social order. The example for the nursing is that individual recognize the importance of social order and follow the law. So here moral reasoning is driven by the need to uphold the law and maintain the social order rather than just seeking approval or avoid punishment. Example here, a patient carefully follow all healthcare protocols in order to maintain the order within the facility, or a nurse place a high value on teamwork and collaboration. They believe that working together and respecting the contribution of others is critical. So here the example try to tell us that uh, they need to we need to uphold to the law and the how to say the instruction of certain institution. Yeah. Okay, stage 5 is for the social contract and individuals, right? So here the example say that a patient questions the doctor's treatment and plans to seek the second opinion from the other hospital because they believe that this is their rights to make informed choices for the best of their health. So this happens a lot nowadays, yeah, because of the technology, because of the uh, uh, social media and internet, and people can inform the others about the other options available from one hospital to the other, which one is the best. So this is what happens nowadays. And for the example of stage this, where only few people can reach this stage, example is that patients participate in the medical research or treatment protocols that are considered controversial or outside of the mainstream because they believe there is a advantage of participating this kind of research for the sake of others, for the sake of the unfortunate people out there. So they tend to make self-sacrifice based on their personal ethics and value. Now we move on to Gilligan theory on the moral, where Colbert focused on the man and Gilligan focused on the such differences in the moral reasoning, or simply say she focused on the woman, the ethics of the woman or the moral of the woman for the others. And example here, based on the perception of the violence, the resolution of the sexual dilemma and abortion decisions, we cannot follow Colbert. Okay? So, Gilligan's theory poses a major challenge to Colbert's theory by introducing a feminist. Feminist means that a woman's perspective of the moral development, where in Colbert, she disagreed that according to Colbert, girls only score at stage 3, good boy, good girl. So, which is concerned about being good person in order to maintain the goodwill and approval of the others. So, for the Colbert, only boys score at stage 4, which for Gilligan, this is not quite true. Even the women, actually, they have their own strength in ethical and moral. So Gilligan's perspective for ethics, this is especially applied to the nursing care because she emphasized on the importance of relationship and connection while making an ethical decision, and it provides a framework for the caring profession such as the value of empathy, compassion, ethical decision making is complex, but it is also integral for providing quality patient care. And in nursing, this means that we need to recognize and value the relationship between the healthcare providers, the nurses, the doctors, as well as with the patients, and their interconnections of individuals within the healthcare system. We cannot just try to obey the law or try to understand everything from the law perspective or the social preference, but we also need to understand the humans or the client's value or for the ethical decision making. So here, that's why Gilligan's put emphasis that for the caring profession, especially for the nurses, where we need to listen actively, try to understand patient's perspective and respond with sensitivity. This one cannot be understood using the Colberts. Yeah? So Gilligan argued that care and responsibility within personal relationship is very important for the moral, and yes, we cannot deny that men and women follow different voices. where men tend to organize a relationship or their based on their moral or due to their hierarchical order, who is the superior, who is the inferior, and subscribe to a morality of rights. So here also Gilligan argued that female will value more on the interpersonal connectedness, the care, the sensitivity, the responsibility to people. So that's why Gilligan come up with another theory. So for Gilligan, there are still three stages. Stage one, pre-conventional, but the goal for the Gilligan's perspective, this is more to individual survival as compared to the Colbert, which is more to self-interest. So there's a transition between selfish to responsibility to others, where uh, uh, people will move to conventional level, which people tend to make self-sacrifice, and another transition from being good to the truth that she is a person too. So people can move to post-conventional level, where in this Gilligan ethic of care, the principle of non-violence, okay, do no harm, do not hurt others and self, is the priority as compared to the Colbert's theory. So the ethics of care to be applied in nursing in each Gilligan stages. For example, at pre-conventional level, the nurse might encounter a situation where patients try to refuse necessary treatment due to personal belief. So for the nurse, ethical decision making, she could employ empathetic communication, understanding patient's perspective, and work collaboratively. And at the conventional level or the second level, where individual focus on meeting the societal expectations, so it more focus on the balancing the rules at the hospital with the patient-centered care. So here, for example, a nurse advocate for the patient's right within the constraint of hospital policy. For example, if the patient looks sad, look gloomy, and requests that the family member to visit outside of office or outside of the visiting hour from the hospital, so maybe the nurse can negotiate, talk to the ward sister to allow the visitor to come even not within the visiting hour. So it can be done based on the caring perspective. Yeah? And the last one is at the post-conventional level, where we need to strike a balance between the need of self and the others. So the simple way to understand this is during the COVID situation. Yeah? So during the COVID situations, the nurse needs to wear PPE. So the needs of self is to protect themselves using the PPE, and the need to others, despite having uh, low resources, need to be outside of the hospital, need to bring out of the hospital equipments to the hall where the COVID patients are situated. So here in this post-conventional stage, the nurse might advocate for just distribution, not just to focus on the certain patients, not just to focus on the certain needs or the individual needs, but to consider as well the unique needs of each patient in the broader perspective for justice and fairness. Yeah. So, even Gilligan received critics, which the critic is on uh, the societal expectation of men and women, not based on the nature of the gender preferences. So this is because of what the societal wants. So because the study only was conducted at a certain context in the Western country, yeah? So it cannot be applied to all, where men and women may have certain differences and similarities, and which means that men and women moral development would follow different paths if society expectations were different. So if the study was conducted in Malaysia, for example, maybe the societal expectation is different, and maybe the application of stages in the ethics is also different. Okay? So, however, research keep on demonstrate that the moral development for men and women tend to follow different trajectories. So, men tend to emphasize on ethics of justice, and women tend to focus on the ethics of care. So, this is acceptable nowadays that we can apply both Kohlberg and Gilligan theory according to the context. So because men, women and girl often prioritize relationship and care over the rules and principles, yeah. So this won't come out in your exam, yeah, except for the certain stages only. Certain stage like for the Kohlbergs, maybe stage 2, or maybe stage 3, I will provide the scenario and you need to choose which stage that this scenario try to portray. So this is the revision for you guys. So the answer is caring and relationship. And in Kohlberg conventional level, what is the focus of stage 3? The answer is social contract and, sorry. Yeah, I think the answer is social contract and individuals, right? So I'll stop here for the other recording for faith developmental theory.